We have a really terrible problem in New York City. It has a great healthcare system if you're well insured. And if you're not, you could end up in a pretty bad way. The private academic medical centers operate two completely different systems of care. They operate a system of care for people who are privately insured, managed by the most experienced, most sophisticated physicians in every specialty area. And then they run the training system. And the clinics are basically run by interns and residents. That's where the medical students train. And the people without insurance will end up there. The systems of care are very, very different in terms of their quality.
Some patients know, but most patients, they think that they're getting the best care and they're not aware that there are these two different systems. And I'm very uncomfortable with that.
I feel like, how dare you? How dare you feel like I don't deserve to be treated? How dare you feel like because I'm on Medicaid, because I have managed care, I don't deserve to get the same treatment as someone else?
Un día estaba llamando al hospital para hacer un appointment con un doctor. Le digo yo a la recepcionista que tengo un plan de salud que da el Estado que se llama Health. Y ella me responde que el appointment mío sería para septiembre. Cuando yo estaba llamando era en abril y para septiembre yo dije, pero ¿qué es esto? Esto no puede ser, si hasta allá yo me muero porque tengo una infección. Llamé al mismo número, hablé con la misma recepcionista y pregunté por un appointment con el mismo doctor, y cuando ella me preguntó qué tipo de seguro de salud tiene, pues yo le respondí el de mi trabajo, que es United Healthcare. Inmediatamente ella me responde y dice, puede venir la próxima semana. Para mí eso fue frustrante al ver que a las personas se lo tratan en dos formas.
Let's just take the issue of having to see a different doctor every time that you come in. That in and of itself will delay any diagnostic or treatment program that you're dealing with, because you're now having to deal with schedules of different physicians at every single visit. I mean, we saw delays in diagnosis of up to 6 months, and then another delay of treatment after that for another 3 months. A 9-month delay in a cancer diagnosis could be life or death.
When I went to you, it was probably stage 2 cancer. Instead, I had to wait all those months, almost a year, and it's stage 4, and it was everywhere.
Right now, the system is very inefficient. You literally have 2 of everything in some of these academic medical centers, because you have the clinics and you have the faculty practices.
It's much more expensive to ignore the problem and address it at the very end than to catch it at the very beginning. And I think that's what the problem is in the clinics in New York City, is that you get largely ignored until you can't ignore it anymore, until it's impossible to ignore.
We want equal care for the people and residents of our community.
We've looked at other places around the country, and some of the best named institutions, the Mayo Clinic, Brigham Hospital, we've talked to people there. They take care of everybody in the same place, at the same time, in the same way.
From a practical standpoint, if you look at my practice, I have successfully integrated private patients with the Medicaid and uninsured patients, and I have not suffered financially. I have not compromise the care of my private patients.
All we're saying is see all the patients in the same place at the same time. Take all of those resources, put them in one place, and lift up the care and the quality of care for everyone.
It's not the absence of resources. It's the lack of will.
It's not right and it's not fair. I think at the most basic level, I'm a human being, just like a private care patient.